which is good. Now I'm gonna go palpitate your lymph nodes, the preocular, postocular, occipital, tonsillar, submandibular, submental. I'm also gonna feel for the superficial and the anterior cervical and the posterior cervical as well as your clavicle nodules, okay? Do you mind if you take your jacket off for me? Tell me if you feel any pain. This is your preocular, postocular, occipital right here. No signs of inflammation. Gonna be your tonsillars, submandibular, submental. And I'm gonna feel for your superficial anterior cervical right here. And the posterior ones. And the deep is gonna rely on the muscle underneath. I'm gonna ask you to shrug your shoulders a little bit right here. See if there's any deformities. Nice. Nothing seems to be founded. Your nodes, your lymph nodes seems to have smooth and circular. Your lymph node seems to have, they were not palpable, which is a good sign, indicates there is no inflammation and there is no infection. So right now we're gonna inspect the mouth and the oral cavity. For now, I'm just gonna take a look at your mouth. Your mouth seems to be dry. There is no discharge or lesions or any fissures. Now I'm gonna shine a light inside your mouth. Are you able to open your mouth? Awesome. Looking over sides of the mouth right now. Lift up your tongue up. Awesome. The epithelial tissue looks pink, and there's no exudates. There's no signs of infection, inflammations. For the purpose of this video, I don't have a tongue depressants, so this will act like one. And with this instrument, I'm gonna test for the lateral sides, the posterior, the soft and the hard palates, and then I'm gonna see your tonsils. And once I put it, I'm gonna have to ask you to say "ah" for me. Okay, can you do that for me? Awesome. Check for the lateral sides of your cheek, the posterior and the anterior, also the superior and the inferior, checking for lesions. And there's no signs of inflammation, no lesions, no exudates, no any white markers. There is also no signs of cavities on the teeth. Your tongue seems to be pinkish, no signs of erythematous or inflammation. It is generally has the same color, and the uvula seems to be intact, no signs of inflammation. There's no signs of inflammation on your tonsils too as well. Appearance is normal in appearance without tonsillar hypertrophy or erythema or exudates or post-nasal drip from it. I'm gonna now do it one more time. I'm gonna ask you to lift your tongue up to see if for the sense duct, and you'll see if it's anything that is blocking it, and look for symmetry and stuff like that. All right, open your tongue. And that just came out. Awesome, awesome. This one too. Nice, nice. The oral mucosa is pink and moist with good detention. The tongue midline with no buccal or gingival nodes or lesions are noted. Now we're going to take a closer look at your ear, and we're going to basically examine it, okay? I'm going to take a look. Are you able to face the left side for me? Just kind of inspecting it. Awesome. I'm going to do some tugging here. Do you feel any pain?
No.
Awesome. What about here if I press?
No.
Awesome. We're going to do the other ear too. Any pain?
No.
What about here?
No.
Awesome. So I just palpated your auricle and the tragus with the mastoid process, and it feels like there is no sign of trauma. I didn't see any earrings on. There is no signs of inflammation or any fever in the area. Now I'm gonna assess your auditory acuity. Are you able to face the wall for me? And I'm gonna whisper something in your ear, okay? Let me know if you hear it. Watermelon.
Watermelon.
Beautiful, that's what I said. I would do the same thing with the other ear. Right now, we're gonna move into the conductory system and we're gonna do the Weber and the Rene test. The Weber is gonna tell me more about about your middle ear, basically. All right, I'm gonna place this on top of your head and let me know if you hear it on one side of the ear or doesn't.
They're both the same.
They're both the same.
Mm-hmm.
Awesome. This is the Weber test, and you did not come positive. And we're gonna do the Rene test, and basically I'm gonna put it behind your ear and let me know when you stop hearing it, okay?
Okay. Stopped. I can hear.
You can hear it, awesome.
Stop. Mm-hmm.
Awesome. This tells me that your ears are intact and in fact your bones conduction is working properly. The external ear and the ear canal. Now we're going to take a closer look with the otoscope. The ear canal seems present, pinkish and flesh color, no signs of distress or exudates. Let me check the other ear. Beautifully, no signs of inflammation or blockage of the ear canal. The exam did come out normal. The external ear and the ear canal are non-tender, without any swelling or deformity. They are atraumatic. The ear canal there's no discharge that is blocking it, and the tympanic membrane are pearly gray with good cone of light. There is no arrhythmias or effusion or lesions in it, and the auditory acuity seems to be intact and came back with a positive whisper test. Today we're gonna we're gonna inspect the nose and we're gonna look for any deformities, any symmetries, and anything abnormal that is going on. I'm gonna take a closer look right now, and it seems that your nose is symmetrical. There is no sign of deformity or discharge. It is atraumatic. I'm gonna test for potency of the nostril airway. And before I'm gonna palpate your sinuses, I'm gonna palpate any symmetry in your nose, okay? Your acromial bone seems to be intact and there is no deviation. It also seems there is no inflammation or any redness. It is symmetrical. It does not have any exudates. There might be some small macules on the superficial of your nose. Are you able to take your glasses off? Because I'm gonna feel for your sinuses.
Mm-hmm.
I'm gonna feel for the maxillary sinus right here. Is there anything hurting?
Mm-mm.
What about here?
No.
Awesome. And that just tells me that the sinus is intact and that it's not inflamed. Right now I'm gonna assess your olfactory sensation. Are you able to close your eyes and tell me what you're smelling?
I smell mint.
Nice, that was gum. Beautiful. So, and then I'm gonna take the otoscope bilaterally and just see if there is any signs of bleeding, lesions, polyps, anything that is abnormal. Are you able to tilt your head a little bit up? Awesome. Beautiful. The other side. Nice. I did not see any polyps, lesions, or bleeding. The airway seems to be open. There is nothing blocking it. Now we're gonna test for the patency of your nose. I'm gonna ask you to close one nostril and breathe through the other one, and have your other hand right underneath of it and tell me if you feel air. when to breathe out. Do you feel air? I'm gonna listen to it too. Do it one more time. Nice. Can you switch the nostrils and do the same exact thing? Awesome. Both nostrils seems to be having the same airflow, which is good. The nasal mucosa is pink and moist. The nasal septum is midline. There's no deviation. The nares are patent and bilaterally, and the olfactory acuity is intact within normal limits. Right now, we're going to take a closer look at your eyes. We're going to examine them. Eyelid seams within normal and no signs of alopecia. Eyelashes are also no signs of distress or flaking. The sclera looks white with no signs of hemorrhage and no signs of conjunctivitis. And your cornea seems to be intact. Are you able to take the glasses off? I'm gonna feel for some ducts around your eyes. Lacrimal ducts over here. And supraorbital ducts over here. Your ducts does not feel warm or any inflammation signs. There's no redness, and they were not able to be palpitated except for your lacrimal ducts. Now we're gonna do some visual acuity, okay? Are you able to put your glasses back on for me? This is called the Parker-Rosenberg, and we're basically gonna assess how far you can see. Are you able to close your right eye for now? And tell me the smallest line you can read.
LTFPH.
Awesome. Can you switch eyes? Can you read the same line?
LTFPH.
Now remove the other hand. Awesome. Now can you read that?
LTFPH.
Perfect. So your eyes are 20 out of 20. Your OD is your right eye, and the OS is the left eye. OU is both eyes, and it seems like you are able to see 20 out of 20 with your glasses. After that, we're gonna be taking a look at your visual sensation, your extraocular movement too. So I'm gonna take a look at my hands. And once you see my hand closing up, you have to tell me, okay?
Yes.
Perfect. Your peripheral visual, it seems to be within normal limits. I'm gonna ask you to follow my finger because I'm gonna be measuring your extraocular movements, okay? Without moving your head. Follow my finger. Awesome. Your cranial nerve 3, 4, and 6 seem to be intact. There's no signs of trauma, and you were able to follow my finger without any nystagmation. I'm gonna take a look at your pupils reflexes, okay? Awesome. Your pupils are equal, reactive, round, and they're light accommodating, both eyes. Now, are you able to take your glasses off? Because I'm gonna be taking a look with the fundoscope. My left eye is gonna measure your left eye, and my right eye is gonna measure your right eye. There is no sign of hemorrhaging or aneurysm in your ocular retina, and I feel this room would have to be dark in order for me to focus on your optic nerve or optic canal. And it seems that there is no hemorrhaging, there is no bleeding on your eyes, and your retina seems to be intact. Thank you. Of nostril bilaterally. Is it the corneal bone? I don't know. At your lateral sides, you move on. Awesome. Sorry, that was.
That's my mouth.
What happened?
That in my mouth.
Did I actually? Oh, I'm sorry. I didn't see.
Die of germs. No. Got the video right, got money. Make sure